I want to talk about some of CSR's actions to mitigate the bias that exists in the biomedical community, the systemic and structural bias in the biomedical community from the peer review process. So that's going to be sort of the focus. But before I get there, I thought I would tell us about the two-stage peer review system at the NIH. I think you're all familiar with it, but it bears repeating. NIH is unique in its two-stage peer review system. The evaluation of scientific merit is the goal of the first stage, which is done in a study section or in SEPs. The second level of review considers the evaluation of scientific merit, and based on that, as well as programmatic priorities and other considerations that are important to the IC, they make recommendations for funding to the Institute Director. So I think this is familiar, but I wanted to set the groundwork here for where peer review lands in the broader picture of NIH. Bruce mentioned some numbers, but I'll give you our latest numbers. In fiscal year 21, NIH received 88,000 applications. More than 66,000, more than three-quarters were reviewed at CSR. And, this is sort of the bread and butter of what CSR does and that you're probably most familiar with. We do a vast majority of the R01s, the small business, as well as the NRSA fellowship applications. What you may be less familiar with is all the special initiatives, especially the trans NIH initiatives and those that have more than one institute involved that are done by CSR. So in the last fiscal year, CSR handled 182 special initiatives. I think some of these you will recognize. I don't think we had a little graphic for RADx, so I would put it right in the middle, but we're in there with RADx as well. And I thought before I got to talking about actions that CSR is taking, I will walk us through briefly the literature on bias and peer review. And I'll preface this by saying that none of the actions that CSR is taking involve studying the problem. Okay, I think the problem has been studied by multiple people within and outside the NIH, and we're not doing that anymore. We're actually taking actions to mitigate bias that exists. But let me walk you through the literature, because some of the literature is very strong and well-powered, and other is not, and it gets quoted around. And I want to make sure that we understand where we stand right now. So, of course, let's start with the Ginther paper, which everyone, I think, understands. That is a well-designed, well-powered study, and a seminal paper published in 2011 that looked at R01s from 2000 to 2006 and found a very disturbing funding gap, award rate gap between Black and white PIs that could not be explained by anything other than race. Ginther has had a number of subsequent papers since then looking at this from very different angles. And 2012 and 2016, looking at gender and PIs at medical schools versus not. And in 2018, she took the same data that was in the original paper and examined the biosketches and found that bibliometric measures, disparate citation rates, disparate publication rates, can explain about half of that Black and white funding gap. She was more circumspect in her later papers and acknowledged that there hasn't been any direct evidence of race as a single variable affecting the peer review outcome. And just this month, I believe, she has a commentary in molecular biology of the cell, kind of reflecting on her many papers and expressing some level of surprise at the lack of attention that her 2018 paper got. But I'd urge you to take a look at it because she does a much nicer job of capturing not just her own papers, but other literature. There were other papers for sure in 2019. So this was not a very well-powered study, and there were questions related to its design, but it was looking, it actually simulated NIH review, did not find advantage of white male advantage, based in peer review. But it wasn't, there were questions raised related to its design and its power. In 2020, Arashova looked at applications. One of the things they found, again, was that the funding gap persists. We know this. It still persists, unfortunately. But the primary question for the Arashova paper was whether there was a commensuration bias, and that is, did the criteria scores come together in ways that are differential for Black and white applicants? And the answer for that primary question in that case was no. Within NIH, this was a paper that I assume that many of you might have been familiar with, that came out in 2019 by Hop. And this paper looked at topics that were submitted by Black PIs compared to those that were submitted by white PIs, and attributed the funding gap, part of the funding gap, to reviewer bias on topic, based on the topic. So this was an interesting paper, got a lot of press. A couple of points. One is that the award rates were indeed different across topic clusters. When we did a very quick initial analysis of the paper, one of the things that struck us was that, the low award rate clusters, which included topics such as, here I list childhood obesity, but there was a lot of minority health topics, social and behavioral science topics. Those had lower award rates than the high award rate clusters that include ocular and much of the sort of basic science and ocular science. So what was puzzling was how this might be attributed to reviewer bias, because these are not topics that were reviewed in the same study sections or by the same reviewers. And so more analysis was done, and NIH did, excuse me, a reanalysis. So this is a paper that Mike Lauer published late last year. And the reanalysis added a pretty important variable that was missing in the original Hop paper, and that is individual institute center award rates as a variable. And I won't go through the paper, but let me point to this plot that was in the preprint as well as the paper. And so this looks, they did the analysis a little bit differently. They broke up topics into clusters which were, including those that were more heavy in number of African Americans who applied to those topics versus others. And if you look at the proportion of applications on what they're calling African American preferred topics, one of the lowest ones is the I Institute. That's also the IC that has the highest award rate, right? And you look at this one, minority health and health disparity down here, has the highest proportion of topics that are preferred by African American Black researchers, but it also has the lowest award rate. And I think one of the things that comes across in this is to think of the NIH award rate not as, Bruce mentioned, I think CDC not being a monolithic agency. NIH is far from monolithic. And it's not a single award rate at the NIH, but 24 different award rates based on the institute and its funding and its priorities and many other factors. So. And then again, the table here simply just shows, they did an analysis of the outcomes of peer review for the different types of clusters. And all I want to show you here is that the discussed rates in the two clusters, those with higher proportion of Black PIs versus lower, was not different. Priority score median, these are all review outcomes, were not different. Percentiles were not different. But where the disparity came in was in the funding decisions. And whether or not they were discussed. If they were discussed, there was still a disparity among discussed applications. So, there's a lot more in the paper. I'd urge you to go take a look at it. But the main conclusion of the paper was that, despite what Hop had proposed, the lower rate of funding for the topics was primarily due to their assignment to institutes that had lower award rates and not due to bias on the part of peer reviewers. And that makes a little more sense given sort of the real disparity in the different topics that are going to different panels. CSR had an anonymization study. So for those of you who've published, this was just published a few months ago in eLife. And this is a study to look at redacted grant applications and see if it changes, if it actually changes the score of Black versus white applicants. For those of you who've been around, over the past 10 years and following this field, you know that when the original Ginther paper came out, one of the recommendations from the advisory committee to the NIH director was that CSR should undertake this study where they redact identifiers and then look at the outcomes, which was done. The study design had 1,200 applications, Black PIs, matched white PIs, and randomly selected white PIs, which would allow us flexibility to do more secondary analyses. These went through peer review. There's some issues with the design. That's all clearly laid out in the paper. But the results, of the primary question was, did the scores of Black PIs improve as a result of the identifiers being removed? And there was no change in the score of Black PIs. But interestingly, the scores of white PIs had a small effect size, but significant worsening. So when you removed identifiers, the sort of advantage white PIs might have wasn't there anymore. Around just over 20% of the time, reviewers were able to identify the PI, even though the identifiers weren't available. This is not surprising. You'd expect this because people know the science and know who's doing what, and it is one of sort of the challenges of looking at an anonymized process for peer review in science. So what does this mean? Does this mean, well, there is no bias against Black PIs in the peer review process? It's not that simple. This was looking very much as race as one single variable, and race is not a single variable. It can't be considered a single variable because it's really challenging to do so. There are a lot of linked variables. There is the differential access, to mentoring, the networks that people are involved in. There's the institutional prestige issue. There's who trained with who and connections. All of these halo effects, come into play. And so it's really hard to tease out just racial bias. What this does tell us is that redaction may have reduced some of these halo effects for whites, and that we should explore approaches that diminish the role of PI identity. And we're doing that. So we start with looking at blinded review processes. So CSR just has an ongoing collaboration with the Common Fund High Risk, High Reward program through their Transformative Research Award. So this one, already is a 3-stage review process, and it kind of lent itself nicely to trying this out in the real world, not a study, but an actual review that was done in an anonymized fashion. So the first 3 stages, it's an editorial board process, had no identifiers. It only had the science that was reviewed. In the middle of the 3rd stage, the identifiers for investigator and institution were provided, and the study section meeting occurred. This was an evaluation that was done by an external contractor. The study section occurred in April. The results were encouraging. So the transformative R01s traditionally have had low numbers, have had not enough diversity, both in terms of gender and in terms of minorities. And this changed significantly, and you can see more of the data at the Common Fund site. Interestingly, around a quarter of the respondents said that the fact that the process was going to be anonymized affected their decision to apply, and assuming in a positive way, because the reasons they provided was that this was funding the project and that the institutional prestige bias wouldn't come into play. So we're going to continue this experiment. But this method of doing the transformative R01 for at least the next couple of years. Okay. The other part is looking at blinded review processes involves the CSR Advisory Committee Working Group. So we talked about how engaged NIBIB Council is. CSR Advisory Committee has been very engaged with us. And is looking sort of at a broader process to simplify peer review, to bring it back to its original mission of looking at the science and the scientific merit. And over the past 10 years, a lot of additions have been added to peer review, a lot of administrative considerations that are burdensome and move the focus away from the science. So we've had a couple of different working groups looking at how to simplify the process and their criteria. Well, one of the things that we got out of both working groups was they suggested reorganizing the 5 review criteria into 3 scored factors, right? Importance of the science, feasibility, and rigor, and taking these factors, investigators and environment, into a 3rd factor. What that does is it allows us to explore a multi-stage, partially blinded review process. And so we are, that is making its way through the NIH at this point, and I'm excited about the possibilities in the future. We're looking. We are incorporating bias training for study section chair orientation sessions. So every year, CSR invites its incoming study section chairs. So about 90 of those. So we have about 180 chartered committees. Chairs are on 2-year terms. So every year we have about half of the chairs cycling off. So those chairs come in every summer, and we go through a 2-hour interactive session. A vast majority of that session is a vignette-based framework, and they spend a lot of time in discussion. We have incorporated bias training and looking at the chair's role in mitigating bias during the study section meeting into that. There is a video that's up on our website, so you can see this and how it plays out the whole 2-hour session. And then I'm very excited to announce that we were able to launch a training module for reviewers in August 2021 prior to the fall meetings. And this is bias awareness. So this, I want to make sure that we understand our goal here is not implicit bias training, which is what you would do for your employees or your staff. We get reviewers for a short amount of time. Their attention is, they're busy people, they have day jobs. And we have them for a limited amount of time. We have to train them on a lot of stuff. So this is very much targeted toward the most common biases that come into peer review and not implicit biases. I would urge you to take a look at this. 30 minutes long. It's delivered to reviewers before the fall meetings. It has been very well received by the scientific community. We've looked at survey results that show that reviewers are much more likely to identify bias and are much more comfortable in intervening. In the fall meetings, we also heard from our SROs and anecdotal evidence from management and SROs who were observing that people speak up and actually refer to the training. You can't say that. We're supposed to only look at this. So it's actually, it's going well. We do intend to continue this training and refresh it and also adapt it based on feedback from these surveys that we get. And I want to acknowledge that we didn't sit in some isolation and develop this training. We had our council very deeply involved in developing scenarios. We had expertise from NIH as well as within council and ad hocs in a working group who helped us develop this training. So I'm very grateful for their assistance. The other thing that we launched in 2021, of March of 2021, was a way for anyone, for applicants, for reviewers, for program staff to report bias in the peer review process. It's through a direct mailbox, this address listed here in red. We have a lot of meetings. We do thousands of meetings every year. We have 18,000 individual reviewers who work with us. It's a human process. We will have mistakes, and we want to hear about them when they happen. So this is a statement that is listed at the bottom of every CSR staff's outgoing emails. Gabriel Fosu is the Associate Director for Diversity and Workforce Development at CSR. He reports directly to me, and this email will go directly to him. We've listed it on staff emails, on web pages, and on study section pages, because those are the ones that get the highest number of hits for CSR. So we want to try to get this disseminated, and we hope you will help us do that. And it's important to note that this isn't just bias against the applicant. It's also bias in the review process. We had some listening sessions a couple of summers ago, and I've heard since, during that and since then, sort of the higher bar that women face, or women and minorities face, in trying to establish expertise during the study section meeting. You know, it's really kind of heartbreaking stories of bringing background data just so that they're taken seriously. And I think that that's really unfortunate. We invite every reviewer because of their expertise. And I want to hear about that if that occurs in a meeting. So this is an open box for anyone to report bias. And what do we do when we get a report? Well, we assess the situation. This is taken out of the hands of the SRO. This is done by management. We take an objective look at it. If we agree that this was a biased process, and we have had multiple cases where we've done this, we review the application in the same council round. We re-review it. And the reason to do that is to not negatively impact the applicant in terms of the timing of their funding. If we're unsure or we don't agree, then we refer them to their normal appeals process and ask them to take it to the program officer and council appeal. But we would appreciate your help in getting this out, because I don't think some of this process existed before, but we want to disseminate it broadly. And finally, I want to talk about broadening our pool and diversifying our review committees. So I'll touch on this briefly. The Early Career Reviewer Program that was established previously through a CSR Advisory Council working group was revamped and expanded significantly in 2020, and we doubled the number of early career reviewers on our standing study sections. And the ECR pool is more diverse. It's a much stronger process, and we have put this in a database which allows us to really track progress and get more data out. Previously, it was a little bit more unstructured. But the bottom line is we have doubled the number of early career reviewers. It's a fantastic program because it really allows early career scientists an inside look at the study section, which might end up reviewing their R01, and gets positive feedback from the ECRs who participated. So please publicize this as well. The other tool that we launched for our scientific review officers is called the Reviewer Finder tool. One thing you need to know about SROs is they're usually in a hurry. There's a bunch of applications that need to recruit people, and they go to their networks, or they go to NIH's networks. We wanted to find a single portal for SROs to be able to go and find a diversity and a broad range of reviewers. So this portal includes all of the early career reviewers. It includes any recommendations from IC program staff. We have a list of funded, underused PIs, and so these are people who are funded by the NIH, but for some reason haven't served, I heard during those listening sessions, I'm funded, but I've never been asked. I don't want to hear that. So we included that. Society recommendations, and most importantly, other agency funding is included in here. That includes the NSF and DOE as NIH moves into broader areas, both in terms of bioengineering and technology development, but also health disparities and other types of community-based research. There are other agencies whose funding databases we can tap into to broaden our pool. And then we also included the applicant pool in this. But in the end, the tools will help. What's really important is culture, right? Is sort of getting our internal culture changed and it's not just us. I mean, I think that CSR and peer review is very much a microcosm of the broader biomedical scientific culture, right? The idea of looking at diversity as a requirement has existed. We have to acknowledge that, move away from that, and emphasize how important it is for NIH to hear diverse perspectives, to make sure that we're identifying the best science for the NIH mission, right? It is critical for the NIH to hear a diversity of perspectives and not have the same people coming and advising in peer review. Changing the messaging again by ensuring that we are clearly communicating that high quality review means diversity in the review committee. And it's multiple dimensions. It's, of course, demographic and geographic, of course. But it's also the scientific background, and it's also career stage and peer review experience. The expectation is that we get new people into the system regularly and refresh panels regularly. The study section membership, the standing study section membership is pretty thorough and has multiple levels of oversight and approval. I approve every study section member nomination, and actually it goes to the NIH Office of the Director for approval. Where we fall short is diversity on special emphasis panels. And even though CSR does a lot of study sections, a majority of our panels are actually special emphasis panels. Those are assembled quickly and on an ad hoc basis, and that's where the numbers don't match up to the standing panels. So what are we doing? Well, we have worked very hard over the last year and a half to raise collective awareness of staff, to emphasize that critical need for diverse perspectives, to set expectations, and most importantly, to share data with our staff, panel level data with our staff. The tools like the reviewer finder that I mentioned is available because, again, the more we go to our mental Rolodex, the more likely we are to bring the same people back in and not broaden the pool. And this allows people to, SROs, to find well-qualified scientists who are available and haven't been tapped. And we have SRO training, and especially, we have a very engaged staff, and many of them are very creative, have excellent ideas, and sort of this peer-to-peer interactions in kind of raising awareness and sharing of best practices and broader recruitment strategies. So it's been working. It's a work in progress, but it's been working. So this is just CSR meetings, all CSR meetings, standing study section meetings, special emphasis panels, and just as a benchmark, applicants in CSR. And this is percentage of women. You look in 2019 and summers, we just took summer meetings just to have a comparison point. In standing study sections, it's slightly enriched in 2019 and 2020. In SEPs, it's about the same level as you would, sort of a random, distribution where SROs are going and recruiting for SEPs from the applicant base and from sort of their networks. In 2021, those numbers went up. They were steadily going up anyway for standing panels because we have more oversight. But I was pleased to see the jump in participation of women on SEPs, even though the applicant base remained kind of the same. That reflects a real effort on the part of our staff, and that some of our efforts are working. We plan to continue to push. Similarly, for underrepresented minorities, about 7.5% of applicants at CSR are underrepresented minorities. In standing study section, that number is more enriched. But in SEPs, it's actually lower than it is in the applicant. But in 2021, those numbers took a jump, and I was pleased to see that, and I think we still have a ways to go, but we will plan to continue pushing efforts. I think in the end, sort of those training and culture change and awareness raising is going to be the highest impact tool that we have, in addition to all the other tools. And what are we doing now? Well, CSR Advisory Council is busy again, and now we have a working group that is looking at inequities in the NRSA fellowship review process. There are multiple ways in which this can be improved, and so we're getting advice from council and a council working group on that. That includes NIH staff as well. We'd like to solicit broader community input. This was a blog that was put out by a couple of our SROs and CSR Deputy Director asking for input, and I would urge you to share this, share your input, and also ask your faculty and other colleagues to share their input into how to improve the fellowship process. So that's all I have. I'm happy to take questions here, and if you want to talk in more depth about anything that I presented, you can reach me directly through this email.